Welcome to Parenting Teens, the podcast where we navigate the ups and downs of raising teenagers. As founders of Ramp Nutritional Products for Teens, we're real parents going through the same challenges, and we bring on experts to offer unique insights and inspiration. Join our community and know you're not alone in your struggles. Hello, everybody, and welcome to the Parenting Teens podcast. My name is Annie Salsberg. I'm here with my friend and colleague, Simona Irwin, and today we have an extra special guest. So I am so excited and pleased to welcome Dr. Jennifer Salsberg to the Parenting Teens podcast. Dr. Jennifer Salsberg is a double board certified dermatologist in Canada and the United States. Following her residency training, she completed a fellowship in dermatologic laser surgery and aesthetic medicine at the University of Toronto. She is an assistant professor at the University of Toronto and on staff at Women's College Hospital in Toronto, as well as her private practice, which is called Avenue MD. In addition, and not included in Dr. Salsberg's bio, is that she is my sister-in-law. And, Jen, I'd like to see that included in your bio moving forward. But, in addition to being a wealth of information on all things skin-related, Jen is a kind and generous human being. And so we're so grateful that you've made some time out of your busy schedule to join us today to talk about all things skin health. Thank you so much, Jen.
Thank you both so much for having me. This is very exciting. As I was telling you before, it's my first podcast. So this is equally as exciting for me.
Amazing. Well, thank you so much. Is there anything, I provided a little bit, I provided your professional background and is there anything else you'd like to add to that in terms of just to kind of give the audience a bit of sense of who you are and what you do either outside of work or in addition to some of that professional training you've done?
Well, a lot of my time is spent doing all the things that you described. And then in addition to that, I spend most of the rest of my time as a mom to my 3 kids.
That's wonderful. 3 fabulous children. Well, as you may or may not know, Jen, part of what we do on this podcast is we bring experts in to help support our community because, as I know you know, both Simona and I are parents to tweens and teens. And one of the bigger issues that we found as we've entered this space is that, while we found there was a lot of resources readily available when our kids were a lot younger, like 0 to 2, 0 to 3, it just doesn't feel as readily available this sort of tween teen space. There is information, but again, of course, because kids are often less receptive to it, there's just not as much. So I'm curious, and before we dive into the parent question, and maybe it's hard to generalize, but when tweens or teens are coming to see you in practice, do you feel like parents are instigating those visits, or do you think the kids are putting up their hands? And how, if any, has that changed in the last 5 to 10 years?
Very good question. And I very much agree on the fact that there's so much that you get as parents in the early years. And it's funny because I was cleaning out my emails from like way back in the day recently. And I reminded myself that I used to get a weekly email from somewhere. I don't even remember where it came from. That was like, your child is now 9 months and 3 weeks old, and like a whole kind of catalog on what to expect at that stage. And I agree. I think it is a lot harder to navigate as kids get older. When kids come in to see me, and by kids, I mean like teen type patients, when they come in to see me, it really can be a mix. Sometimes it's the parent and the teenager may have no concerns, but the parent is seeing what's happening and it's bothering them or, making them want to seek out some further care. Alternatively, it can be the flip side where the parent is kind of like, you're fine. And it's the teenager who's really pushing and saying, you know what, I'm not so thrilled. I'd really love to speak to somebody a little bit more about this. So it comes from both sides, really.
Do you find with the influx, and I know I'm really digressing from our community question, I'm always just really curious, do you find that with the readily available information on things like TikTok and Instagram, I feel like all healthcare professionals, especially medical doctors, are seeing so many DIY approaches. Is that something that is particularly notable in skin health?
Yes, that's for sure. And it's all ages. It's especially prevalent in the younger kind of teenage to 20-ish year old population where they live so much of their life online and so much of who they turn to as their kind of pillars of knowledge are people that they see on things like Instagram and TikTok. So oftentimes they're coming in with a thought on what the diagnosis is or what the best approach or treatment is going to be based on often a lay person that they happen to follow who may have had a similar experience or something along those lines.
It's so tricky. And I would say on the upside, for often stigmatized conditions like acne, which we're going to talk about, in some ways, I have to wonder if there's also like an upside or a positive where it normalizes it, can maybe support individuals in not feeling so alone in their condition and provide some hope, potentially.
And at the end of the day, education is the key, right? So having these platforms is amazing when the word that's getting out is the right word. It's the right education. And so something like what you guys are doing, like when we can get good information out there, then absolutely it's so amazing that we can normalize things and let people know that there are options and help and things that might have really isolated people years and years ago makes them feel less isolated. So there's definitely a double-edged sword when it comes to that whole thing. But as long as we can get good education out there, then it's great.
That's awesome. So maybe that's a really good segue to the community question that we received, for which we sought your expertise. So maybe I'll turn it over to Simona, and you can share that question with Jen.
Yeah, great. I was thinking when you were saying good information, and I know this question has to do with acne, I was thinking some of the bad information that I had when I was younger. And it's like, put some toothpaste here, a little bit of this, a little bit of that, and trying all these different things. And I imagine with social media now, it's just like next level of homemade like concoctions to put on acne. And yes, so
Sometimes like really, really out there what people will come in and ask. Yeah.
yeah. Okay, so this question is, please help. Skin has become a major source of stress for my young teen. They're starting to break out and it's making them extremely self-conscious. There are so many options on the market and I'm not sure where to start. Any tips on how to keep pimples at bay and decrease the intensity of breakouts after they occur? And I would add to that too, just for my own question, and prevent scarring as well.
Mm-hmm. So a very good question, a very common question. Acne, as we know, is a very, very common disease. And I use the term disease because it is. It's a skin disease. And sometimes we can trivialize it. And I think, back in the day, there used to be this like, you know what, it's a rite of passage, teenage acne, everyone goes through it. So, deal with it and you'll grow out of it and all will be well. I think our attitudes have shifted. I hope our attitudes have shifted where we realize that it is a skin disease that deserves treatment and it can have a lot of impact on so many levels. There's a psychosocial impact that can be really critical when you are a teenager and you're trying to sort yourself out in terms of your identity and where you kind of belong and fit. And if you aren't feeling great about how you look, then that can certainly have long-standing implications. And so when we look at options for treatment, and there are so many options, it's really important I think the first step is people's awareness in, this is a skin disease and it does have lots of treatment options and we should look to it as such.
As we talked about earlier, either a teen will say to their parent, this is bothering me. I'd like some additional support. What TikTok treatments are not cutting it. Or the parent will say, listen, let's see how we can help you. Do you find that part of that visit is that like you're saying, it's like the first part is that education. So again, understanding, and I'm sure every parent can appreciate that every situation is unique. No two individuals are going to be the same. Do you find that you're doing a lot of education for teens on, I don't want to trivialize it, like basic hygiene? Is there like that is like probably a big part of it? Would you say most teens don't know how to wash their face and take care of their face just on a daily?
Yeah. And when we look at acne treatment, you can almost think of it like a ladder. And so some people come in and they're relatively mild in terms of their initial presentation with their acne. And so we can kind of start at the bottom rung of the ladder. And sometimes I'm seeing someone for the first time with acne that's so severe that we're going to kind of we're going to bypass all those steps and jump to something that's much more what we would call kind of like a third line treatment, because they're just that bad that we want to get to it as fast as possible. But when we talk about that kind of bottom line of the ladder, it's all of those basic things. It's things like knowing that you need to wash your face every day. And that's not something that all children are doing, but definitely something that once you start to get into those adolescent years should become basic practice, but not always something that teens know that they need to be doing. So sometimes, depending on how severe the acne is, the first presentation or the first conversation around treatment might be really simple, kind of basic measures. And that might be all the person needed to get the job done. And so the conversation will veer depending on the severity that they're presenting with. But always at the backbone of what we're doing, even when we're jumping ahead to more invasive treatments, what's happening at home in terms of behaviors and kind of hygiene and face washing is going to be critical regardless of what stage of acne you're in. And so, even thinking around what some of their other extracurriculars or hobbies may be and how that might play in. If you have a teen who's really athletic and is sweating all the time, then they need to be doing something that's going to help to cleanse their skin after they're doing those activities. So just a simple washing your face at night before bed might not cut it if they're out and throughout the day doing whatever sports it is, or under really kind of thick and sweaty and occlusive hockey equipment. Then having those other considerations and getting those habits into place will be critical, because anything else we're doing treatment wise, if they're sweating and wearing all these layers and not cleansing that off, then there's unlikely to be success. Similarly, depending what they're using for other things, right? So if you have a teen who is suddenly really into the way their hair looks and using all kinds of hair products and hair gels and those sorts of things, again, that might be playing a role in terms of breakouts they might be getting on their forehead. And so a deep dive into like what's happening in your life, what are your extracurriculars, what are you doing for your body care with respect to other things? How might that be playing into your acne? And really teasing out all of those aspects in order to optimize success with treatment.
That makes a lot of sense. Do you think, I'm just thinking of myself now and my kids, but thinking when I was a teenager, I had pretty severe, like cystic acne on my cheeks. And I was thinking about my son, he's 12 and, starting to get older. And I was wondering, when if he starts to get acne, does it make sense to, look into treatments earlier when it's mild, is it something that like progresses as an example that you can kind of get on top of, or is there just so many factors?
So that's kind of a yes and no. I think it's never too early to get good baseline habits at play. So,
Yeah.
the real crux of what starts to shift is when puberty starts to kick in. Then you have we'll go into the kind of medical speak for a minute, but you get the kind of uptick of some of those hormones, and those
Mhm.
kick the sebaceous glands into high gear. And then you're starting to get those. You can picture like a young child's skin is like this like flawless alabaster.
So nice. It's
So nice.
perfect. It's so great.
And then there's that switch. And so those circulating hormones and those changes in terms of getting, those sebaceous glands get bigger, and then they secrete lots of sebum and everything starts to kind of kick in. At that point, when you're starting to see other aspects of puberty and you're starting to see that skin shift, that's a great time to do something as simple as just say, let's get into washing your face every day. And there might
Mhm.
not be acne yet, but just that idea of now there's skin that's different, and that should probably be cleansed at least once a day before bed, and getting into those habits and then seeing where that goes. And it'll be a huge spectrum. Some people will never have acne. Some will have acne that's mild and may never progress. And some will have acne that, will kind of progress through stages and get to a point where it is more like, nodule cysts, that kind of a thing. But baseline habits, when you're starting to see those changes, is definitely not a bad idea.
Mhm.
I have a question for you, and there may not be a correct, but I'm curious about your preference, if there is one, or if it's just however works for the family or the child or the individual. Are you, and maybe you can't say, but are you a fan of wipes, or are you a soap and water and a clean towel? Are you a warm compress and wipe and scrub? Like, is there a right way to wash your face?
There is, yeah. So
Okay.
generally speaking, I'm like a gentle non-soap cleanser in the evening. It's going to be kind to your skin barrier, so it's not going to be overly dry. Also, a little bit of like this ancient concept of like your face being squeaky clean, or the idea that you wash your face and then you have that like tight feeling. That's not great. That's not ideal. That tight feeling is that we've like scrubbed off all our skin's natural oils, and now we have to wait for our skin to replenish itself.
Mm,
So, there's also, we can get into this in a sec, but so much misinformation around like that idea, especially in teens, of needing to like scrub your face clean. You want to
Right.
be gentle, and no amount of scrubbing is going to scrub away your acne. That's just not how it's going to work. So, generally speaking, I'll tell them to use a gentle cleanser and with warm, kind of tepid water, nothing too hot, and just gently cleanse. The idea of wipes, I mean, it's appealing because of the ease of it. I just, from like an environmental standpoint, don't love that. It's not necessary. We can get the job done where we're not creating that type of waste. But for some people, they find that it's just not going to happen unless that's how they do it. So if that's the case, then that's fine. But I think just a simple cleanser and water is not going to steer you wrong.
I love that. That's great. And I will say, having two teens in my house, wipes seems to be the preferred method. And I hear you. It would be ideal from my perspective if they could get into the habit of soap and water. I have not seen that yet, but I appreciate that they're doing some that basic hygiene. They're like, it's part of their evening routine now,
Yeah.
and perhaps it'll morph into the soap and water at some point. But
mhm.
yeah, but they seem to like that routine. I
Yeah.
do find. I remember, and this is a little bit of a tangent. I did not have acne in my teen years. I had it later on, more in my 20s. And I remember being so surprised, not surprised, just nobody had ever mentioned it to me when somebody told me about, like, how often do you change your pillowcase? And and it just seemed like such an obvious thing that I mean, I did change it frequently, but I also thought, like, maybe I'm not changing it often enough. So again, I really appreciate what you said. And again, this is like, there can be some great information online, like on social media, but I so value that you are taking the time to really understand things as detailed as what hair products are you using? Is there anything new? How often do you play hockey? What equipment are you wearing? Walk me through your routine. Because again, there's all these like big and small details that can make such a big difference.
Such a big difference. Well, and so it starts with that, but then even everything, and this goes for everyone, but I think teens even a little bit more so. Sometimes there's that reaction of being like, okay, you've got acne, great. We're going to get you a prescription. You write the script, you hand it off. They have not the first clue how to use it. So even
Mhm.
simple things about like, here's how you apply a prescription product. Here's how you apply a moisturizer. Moisturizer is another huge thing that a lot of acne patients will think, my skin is oily. I have acne. I should never be putting a moisturizer on my face. When really, there's been a lot of evidence and studies have shown that there's a huge barrier disruption in patients with acne, and moisturizers, even in the absence of active acne treatments, can be really helpful for their acne. Obviously, it has to be the right thing. So you don't want anything oil based, and it has to be something that's not overly occlusive, but getting them even in the right routine and in the headspace of realizing that can, I find, be really, really critical. And
Mm.
so just simple education around those types of things, like changing your pillowcase, like you said, the way you wash your face. And when it comes to acne treatment, so much of what we're looking to do is actually preventative rather than treatment. And that's, I think, the crux of where a lot of people don't understand. They kind of wait to get the pimple or wait to get the breakout. And then they're like, oh, but I have that prescription, so I'll just throw that on. And then they want it kind of clear as fast as possible. So they just throw on tons of the prescription And then they
Mhm.
overly dry their skin. But the acne doesn't go away that quickly. So much of it is realizing that when we're giving treatments for acne, yes, we obviously want to clear the acne that's currently there, but so much of what we're doing is trying to get the skin to a baseline and then preventing future breakouts. So it's not let's wait for the skin to break out and then try to scramble to clear it, but more let's get into a habit of doing something really routinely so that the skin clears and then stays clear.
That makes a lot of sense.
Yeah.
And without naming names, would you say that most of what is found in a typical pharmacy is again, maybe this is too broad of a question, but I'm just curious if people are, in your estimation, better off having someone who's a medical professional be that first stop before self-serving from that aisle that seems to be getting bigger and bigger in the pharmacy, where there's just wipes and creams and all these things geared towards breakouts.
And that's the whole problem. No, it's not a problem. I mean, it's great to have options, but it can be very overwhelming and confusing. And so a lot of times patients just go and they stand there and they're like, I don't even know what to reach for. I don't think every
Mhm.
patient with mild acne needs to be seeing a dermatologist, but definitely, hopefully, having a little bit of guidance in terms of what our ideal options as a starting place for treatment is great. And so I think once those habits are in place, like we were talking about, and if you find you need to then kind of jump up to the next rung of the ladder, which would be your more over the counter kind of drugstore type treatments, then you want to kind of look for a few key ingredients that are targeted towards acne specifically that should be used daily for at least a few months and see if that's going to work. So things that contain benzoyl peroxide can often be quite helpful as a starting place. Things that contain salicylic acid can be a great starting point. So there's a number of different products on the market that have low percentages of both sal acid or benzoyl peroxide. Those are initially what I would recommend for people to use. And then remembering that you have to use it consistently in order for it to work. And you have to
Mhm.
be patient. So this is not I used it for a week and I don't find I'm better. Really, to give yourself a true sense of whether something has worked, you want to be consistently using it for anywhere from 3 to 4 months. And that's just to
Mm.
start to tell if it's going to work. Most of the studies go out to 6 months, and you can continue to see benefit there. And when we look even beyond there, you're continuing to see benefit. So the question at 3 to 4 months is, has it done anything? And if the
Mhm.
answer is yes, there's still the chance it's going to do more. So you still want to stick with it and give it time and let it kind of get to its full potential. If you get to the 3 to 4 month mark and you're like, no, it's either done nothing or I'm worse, that's then the time to say, okay, well, clearly I'm kind of beyond this realm and need to get into possibly prescriptions or whatever else that might look like. But definitely the idea of giving it that much time, I find, is often a surprise to people. A lot of times I see people who are like, yeah, I tried that treatment. And oh, how long? Oh, I tried it for a week or I tried it for 2 weeks. Sometimes they'll say, oh, I did it for a whole month. But it's really not enough time to determine whether or not something is going to work.
That's a genuine surprise to me. I wouldn't have thought 3. I would have thought a month for sure. I did not think that seems like a long time, and especially in the life of a tweener teen.
Well, that's it. We're talking
I'm like, that's a good percentage of their life.
and yes, they're definitely impatient. So a lot of the conversation that I have is around that. It's,
Yeah.
this is not something that's going to get better with a snap of a finger. And if
Mhm.
the whole idea is, if you find the right combination of things to use, they'll be clear and they will stay clear. So it may not be the
Mhm.
first thing we try, it may not be the second thing we try, but once we get it right, that's it. You're done. Like, your skin will be clear. You'll keep that up and you're golden. So it's better to do it properly, to take the time initially to find that kind of secret sauce and then reap the benefit of it long term versus bounce around, I did this a month, I did that a month, I did that, and you're getting nowhere really.
Yeah. Yeah, that makes a lot of sense, and I'm sure that's really helpful for a lot of parents to hear, because I'm sure the desire to jump or to switch or to try something different is probably very compelling
Yeah.
if there's not an immediate effect that's obvious.
And you're in
Yeah.
a world where you're watching these things where someone's telling you miracle cure, just do this
Yeah.
and you'll be amazing, or just do this one treatment, or you walk into a store and they're like throwing a million options at you. So it's hard to ignore all of that.
It really is.
Yeah.
As an adult, it's hard. So I can't.
Let alone. Yeah.
I'm still a sucker for, the teeth whitening where they put it on their tooth and it changes color. I'm like, that
Oh
sounds
my God.
amazing.
Miracle.
Or any of the skin, the face yoga. I'm like,
Yeah.
should I get that app or not? I don't know.
That's
No.
that's part 2 of the podcast. That's for the parents.
I know. Now we need our faces.
Yeah, backed by popular demand. I think we'll have us another session with Jen. Okay, well, that's really, really helpful. Are there any other questions that we wanted to dive in on here? I mean, I think, Simona, you had added a question about scarring. And so I don't know if we could just sort of come back to that, if there's anything you could add on that.
Yeah.
Absolutely.
Like to pop the pimple or not pop the pimple.
That's always a no. The answer is
Always a no. That's a bumper sticker. Don't pump the pimple.
You're just going to increase the risk of scarring. So you have to think about it as what's coming out the surface is also going deeper. And you're going to be in a situation where, number one, you're probably going to create a bit of a scab or something that's going to last longer than what the pimple itself would have lasted. And you're increasing the risk of getting that deeper inflammation, of possibly creating marks that are going to last. They make now those little hydrocolloid pimple patches. It's a great little option for people who want to do something to an individual spot. But yeah, popping is not the move.
Okay.
And then scarring wise, it's definitely, so the thing with acne is we want to treat it as early and aggressively as needed to minimize the risk of scarring. Because acne, obviously we can treat, scars we can treat, but much trickier to treat. Going to take lots of potentially expensive treatment options. And so getting the acne clear before it gets into scarring zone is ideal. And it's not even necessarily a timing or a severity thing. So it's not like, oh, I've had acne for so long and then it's scarred. Some people are just prone to scarring. So they may get scars even very early on in their acne experience. And sometimes it's milder acne lesions that scar, not always even the big deep ones. So it's more if that person is prone to scarring than the duration or type of acne that they have. Scarring is treatable. And so generally what we would do is definitely we want to get the acne under control first, because what I often will say is that if you're treating scars and then creating new scars, you're just basically chasing your tail. So especially because the scar treatments can be quite costly. You want to kind of know that the acne has cleared up for the most part, see what you're left with, and then get into that conversation around what can be done for scars. And what can be done for scars really depends on the presentation of the scar. So sometimes it's not so much of a textural scar, but it's more either pigmentation, whether it's lighter or darker than the surrounding skin. It can be persistent redness. And then it can also have a textural component. And all of those have different treatments. So oftentimes patients don't present with one scar type, but often have multiple scar types. And so it just becomes a question of what multiple modalities of treatment are we going to use to target all those different aspects.
Yeah.
You're so knowledgeable, Jen. I love it. I love it so much. This was super helpful. And again, I definitely learned a few things. And as our boys are kind of going through this stage, I think it's really helpful for us to keep in mind. I'm sure we will get some follow-up questions on this episode. So we'd love to have you back to talk more things skin if that's something you're open to.
Absolutely.
But as we close out, we'd love to put our final question to you that we ask all of our guests. Of course, the reason we started this podcast was to provide, as you said earlier, education and resources. And we also want to inspire parents with more ideas about how they can foster connection with their own children. And because we respect the guests that come on this podcast so much, we love to ask them that too. So if you're comfortable, would love for you to share with our community sort of one action or something that you do that you feel like really helps to foster connection with one or all of your own children.
That is a good question. I would say there's a couple of things. I would say one of the things that I think is a little bit easier said than done is just to try and find as much one-on-one time as possible, which, the more kids you have, the harder that becomes. Just there's only
The ratio is off, Jen.
well, partially, there's only so many hours in the day, but I do find the dynamic shifts, and when you can get that kind of more isolated, looking each other in the eyes without the distractions of everything else around you, I find that's when some of the real gems in terms of, conversations and ideas come out. The other thing that, again, I wish I could do more of, but I love to do when I can, is I try to read the same books that my kids are reading. So, if they are reading some, they kind of will pick up whenever they find interesting, but I've started when I can trying to just grab the book and read it. And then that also I find fosters some really nice and interesting conversations. And it's obviously not the books that I would necessarily be reaching for in my own spare time, but it's a nice little way of connecting that I find creates some good conversation.
I
Oh,
love
I
that.
love that. Yeah, that's a great idea. I've never thought about that, but I can see that being really good.
Yeah, I love that so much. As we close, I'd love for you, if you'd like, to share how people who are listening can find out more about your work, and what you do professionally. Do you have a website or social media handle that you'd like to share with our community?
So I practice out of two places, and one of them is hospital based. So there's not a big hospital based social media presence. And then I have a second practice that you had mentioned, Avenue MD, where we have a website and Instagram and all of those things.
Great. Is that just avenuemd.com?
avenuemd.com and avenue.md on Instagram.
On Instagram. Wonderful. Well, thank you so much, Jen. As I said earlier, it's like a real gift to have you on the podcast. And just thank you so much. Appreciate
Thanks for having me. This was fun.
Thanks.
Thank you. Thanks for tuning in to Parenting Teens. We hope you found today's episode informative and helpful. Don't forget to subscribe so you never miss an episode. If you want to dive deep into teen-related resources, visit our website at drinkramp.com. Do you have a teen-related question? Drop it on SpeakPipe at speakpipe.com/parenting teens. As always, we're here to support you on your parenting journey. Until next time.